To dive more into this breast cancer research that's being presented at the 2018 ASCO annual meeting is Dr. Skip Burris, who is President of Clinical Operations and Chief Medical Officer for Sarah Cannon Research Institute and ASCO's President-elect for the 2019-2020 term. Welcome, Dr. Burris.
Hi, thank you very much.
Sure. So we're seeing some interesting data at the meeting in breast cancer this year, of course. Can you shed some light on the eagerly awaited TAILORx findings?
The TAILORx story was a packed house, folks in there. The theme of this year's meeting was precision medicine, and this was actually an interesting way of taking the Oncotype DX 21 gene recurrence score and actually looking at patients who don't need to be treated. So we knew the high recurrence score patients needed chemotherapy. The data a few years ago showed that the low recurrence score did not, and that was that intermediate middle group that is the one we still debate. The curves were on top of each other. There was clearly no benefit shown in the intermediate group for the addition of chemotherapy. Of course, being interested in the individual patient and being the research advocates we are, there begins the subset analysis. And so I think the one thing that folks still left on the table were younger patients, and whether you're talking about premenopausal or under the age of 50, and those folks who had a recurrence score that was getting close to high, that might be a group to still have the conversation with and talk about. But I think the most important thing to take away from it is that tens of thousands of women now in the US alone each year will not need chemotherapy, and that's a great story.
Definitely, great story. So the Sandpiper study looked at the PI3K inhibitor tesalicib plus fulvestrant in estrogen receptor positive PIK3CA mutant locally advanced or metastatic breast cancer. So what do you make of these results, and are we going to take any kind of next steps with this agent?
So the Sandpiper trial was interesting, and I'll just mention that in addition to the Sandpiper trial, there was the Lotus study that looked at the AKT inhibitor, and then there was the PAC trial that also looked at the AstraZeneca AKT inhibitor. So we had some Roche Genentech PI3 AKT drugs being utilized, as well as the AstraZeneca compound. They're in that PI3 AKT TOR pathway that is the most aberrant, most commonly mutated pathway in breast cancer, and yet it's been a struggle to figure out where to go in this group of patients. I think the Sandpiper trial, positive with progression-free survival, so a study that shows us that there are patients that will benefit, there's patients that do get this sort of effect, and where things are heading is, I think, looking at which particular group of patients should be exposed to this therapy. So I think we're going to be looking at really high-risk patients that are more triple negative, that don't get the benefit of hormone therapy, the HER2 normal group, and study these further. We're going to see a number of phase 3 trials looking at these drugs in patients that are high risk, and it'll be interesting to see how it plays out, almost following the lung cancer paradigm of subsetting breast cancer a little bit further. And I think that's great. I think the triple negative group shouldn't be the triple negative group. That's not a great identifier, and what we can do to better be positive about where they should benefit, that'll help many patients.
Definitely, great points. Now, what are some other breast cancer abstracts on the meeting schedule this year that you're really excited about?
So, it's felt like for the last 5 to 10 years that we have to be getting to a place where there's no more advances in HER2 positive breast cancer. And yet, ASCO after ASCO, meeting after meeting, we see something encouraging. This year was on a few different areas. I think the Persephone trial, the study that looked at 6 versus 12 months of trastuzumab was interesting. George Sledge, one of the ASCO past presidents and a breast cancer thought leader, commented on his excitement about the fact that there appears to be a group of patients that can receive just 6 months of adjuvant trastuzumab, which is nice. Now, these women were all in a risk category where they received chemotherapy. So they received chemotherapy plus trastuzumab, but by all the statistical parameters, 6 months was as good as 12 months, and that's a positive story. And there was less toxicity, not surprising by limiting that. The other story on the HER2 front is in the world of antibody drug conjugates. We've had adotrastuzumab and emtansine, or TDM1, for a few years now. Proud of Sarah Cannon's work with that compound, and now we have the topoisomerase 1 linked HER2 ADC. Daiichi's antibody drug conjugate, 8201, very positive results, great responses in patients that had been previously treated. I think the neat thing about this compound, being a topoisomerase 1 inhibitor as the payload, no neurotoxicity, Doesn't appear to be a lot of additive cumulative toxicity. So a different mechanism of action, fairly well tolerated, an encouraging story for additional options.
Wonderful. And then finally, just reflecting back on the abstracts this year, what do you think this really speaks to the evolution of breast cancer treatment?
So the evolution of breast cancer treatment, I think, is heading in the direction of trying to learn how molecular profiling, next generation sequencing, additional insights into how we treat breast cancer could be used to decide who's going to benefit and in what sequence of therapies. We didn't talk about the CDK4 and 6 inhibitors, but we now have 3 approved. And it's clear in that group of patients that we're beginning to think of NGS or molecular profiling as to why patients are progressing. A very nice presentation from Nick Turner talking about what might be some of those mechanisms. The therapies continue to move forward. So yesterday's therapy approved in late stage disease, now being used first line, tomorrow used adjuvantly. Just a great story for breast cancer patients. And one final comment, I love the fact that Joe Sperano, when he presented TAILORx, described the patients as volunteers. And they gave heart and soul to the study, participated. Certainly they were patients. We're all patients in one form or another. And the fact that he acknowledged they volunteered to help advance the science, a great way to word it.
Definitely. Well, Dr. Burris, thank you so much for taking the time out of your busy schedule today to talk with us, and congratulations on your new role with ASCO.
Thank you so much. I appreciate it.
Thanks.